been asked to talk briefly and give an overview about how birth injury and the kinds of injuries that we see at this firm leads to cerebral palsy. Cerebral palsy is an umbrella diagnosis. It is caused by brain injury or brain malformation that occurs before, during, or immediately after birth. All of this time while the infant's brain is under development. But how a brain injury affects a child's motor functioning, intellectual abilities, is highly dependent on the nature of the brain injury, where the damage occurs, and how severe it is. When we talk about cerebral palsy, what we're really talking about is an overview, an umbrella of symptoms and conditions that result from specific kinds of brain injuries in children, in newborns, or more particularly, brain injury of the fetus before delivery. As a result of the brain injury, during this period of development, the child's muscle control, muscle coordination, muscle tone, reflex, posture, and balance are all affected. It can also impact a child's fine motor skills, gross motor skills, and oral functioning. Oral functioning doesn't just mean difficulties with speech. What we see with our kids is a wide variety of oral dysfunction, oral motor dysfunction, including eating disorders, difficulty breathing, difficulty with tongue reflexes. Every case of CP is unique. There is no way to just diagnose a child with CP and understand what that means. It is absolutely unique to the individual, grown-up or child, and for the kids we represent, and for their families. Each picture of cerebral palsy within that child and within that family is unique to them. This uniqueness is due in part to the type of injury, the extent of injury, timing of the injury to the developing brain. And the brain damage that causes cerebral palsy is a result of either prenatal disturbance of brain cell migration, genetic and environmental factors can disturb cell migration as cells move to their appropriate location during brain development. So that's a genetic cause of CP. Prenatal poor myelination of developing nerve cell fibers, where poor myelin, the myelin sheath surrounding each neuron, provides an inadequate protective covering over nerve cells and in the transmission of messages between those cells. Perinatal brain cell death, and that is what we really deal with in this firm. That is brain injury and perinatal brain cell death during the birthing process. That brain cell death can rupture blood vessels or starve oxygen to the brain. Another cause can be postnatal, non-functional or inappropriate connections, the synapses between the brain cells. That can be caused by trauma, infections, or asphyxia. That any of those things that damage connections developed in the brain. There are four basic types of brain damage that can cause CP. The brain damage that causes motor impairment in CP results from one of four types of brain injury of brain or brain malformation. So first there's PVL, paraventricular leukomalacia, and that means damage to the white matter tissue in the brain. Experts report in the literature that decreased blood flow or damage to paraventricular tissue is an underlying cause of what's called paraventricular leukomalacia. Infants who are born before 32 weeks of gestation and who are mechanically ventilated are at greatest risk for PVL. Hypotension, hypoxemia, acidosis, hypocarbia in ventilated premature infants can all cause PVL, and a number of other events also pose a significant risk of increase. Those can be intrauterine infection, where abnormal bacteria can infect the amniotic fluid. Those are the kinds of things that we see leading to PVL. The next is IVH, intraventricular hemorrhage, and that's a brain hemorrhage, hemorrhaging going on inside the brain clinically referred to as IVH, can damage or kill areas of the brain because of lack of blood flow, because of that hemorrhage, the hemorrhage of blood. How severe the impairment is, where the impairment will be, is dependent on the location of the hemorrhage and the degree of the hemorrhage. And that's for arterial or venous hemorrhages. Arterial bleeding resulting in additional loss of oxygen to tissues and arteries can, instead of carrying oxygenated blood to the heart and to the brain, can hemorrhage, and so you have a lack of blood and a lack of oxygen to the brain and to the heart. If it's venous bleeding, that's more of an internal hemorrhage that returns the blood flow to the heart. Those arterial hemorrhages are much harder to control once they occur than a venous hemorrhage. Next, what we see most often in our firm and what leads to the lawsuits in children and families we represent is HIE injury. And that's hypoxic ischemic encephalopathy. And that's simply a lack of oxygen to the brain, asphyxia, or intrapartum asphyxia. HIE is the brain injury caused by oxygen deprivation to the brain. When that occurs, the newborn's body can compensate for brief periods of depleted oxygen. But if the asphyxia lasts for a long period of time, brain tissue is destroyed. The way to think of this is when HIE injury occurs during labor and delivery, one of the ways I think of it is that the birthing process for the fetus is traumatic. It is. Mom's pushing, mom's contractions all compress the oxygen that the baby will be delivered. And when that oxygen is compressed through the placenta, the baby's heart rate will drop or can rise depending on how hard the baby's working to breathe. But the baby's under stress. And the way I think of this is like a long distance swimmer who is swimming and is tired the longer they go on a long open water swim. The pressures of mom's contractions are like waves hitting a swimmer. They squeeze the baby and they deprive the baby of oxygen. And as long as the wave subsides and the swimmer is able to get through the wave and have a period of time where they can catch their breath before being hit by another wave, then the long distance swimmer can continue for as long as their body can last. It's the same with babies. Babies are incredibly resilient and they're built to be able to withstand the pressures of labor and delivery. But it's when we see that the baby is under constant, unrelenting pressure and the baby is not having an opportunity to recover. And we can see this from the fetal heart monitor strips that mom wears during labor and delivery. And it's common in the cases that we ultimately take on after all of the cases we've reviewed to see the doctors and the labor and delivery team or the midwife and the labor and delivery team missing. And if not entirely missing, they may even note the moments that the baby is in a non-reassuring state, the moments that the baby is in distress, either missing them entirely or downplaying them. And watching and waiting or being distracted or caring for another patient instead of the mother whose child is in distress, and allowing the baby to be hit by wave after wave after wave after wave and not recover and suffer oxygen depletion and HIE injury. Those are the primary kinds of injuries that we see at this firm. It is often HIE injury either from compression and pressure during delivery or from a constant, periodic, reduced oxygen flow to the baby so that the baby, much like the swimmer, is hit by wave after wave after wave after wave of mom's contraction and is not allowed to recover. How that brain injury manifests into cerebral palsy and what that means, what motor dysfunction, is it gross motor dysfunction with the trunk or difficulty sitting up or standing? Is it more fine motor function? And how does it affect the child cognitively? Does it affect oral motor dysfunction in speech or swallowing? It's different with every kid. Every single child we represent and every single family we represent has a different story. And just saying that their child suffered a birth injury doesn't tell you how the child's doing. Just saying that the child suffered HIE injury during delivery doesn't tell you how the child's doing. You have to watch them grow up and spend time with them and bring the experts in to really take a deep look at these kids to understand how they're doing and what they struggle with and what they need.